much. Now to a story you'll see only on NBC Bay Area, a breakthrough with cancer treatment developed in our own backyard. It's already helped several local patients who have had to fight the most common kind of skin cancer. NBC Bay Area Stephanie Trung joins us in our studio tonight. And Stephanie, I understand this could lead to a breakthrough treatment with other types of cancer as well, correct?
That's right, Raj. It's great news. Now, 1 year ago, Winnie Bazurto was at risk of losing the vision in her right eye and possibly her eye altogether. But then doctors at the Stanford School of Medicine gave her one more option. It was huge relief because surgery and radiation are both off the table for Winnie, who's 101 years old.
I can remember World War I.
It was 1911. William Howard Taft was commander-in-chief.
I was born and raised in Oakland.
When Winnie Bazurto was born.
I will be 102 on August the 25th.
And still fiery with her trademark spark.
Yes.
Remember your place.
Yes, ma'am.
Her granddaughter, Gail Carley, says even at 101, she's tough to keep up with.
She's never known what slow means.
But her life did slow down. January 2012, when Gail, a nurse, noticed lumps seemingly multiplying around her grandmother's right eye.
It was swelling, plus I couldn't see well.
Winnie's doctor told her she had basal cell carcinoma, the most common kind of skin cancer, followed by even graver news, that the 8-hour surgery or 30 days of radiation therapy necessary would be too hard on the then 100-year-old.
I didn't think anything was going to... Let's face it. At this stage of the game.
That's when doctors at Stanford asked her to take part in a research program involving about 100 patients taking a newly FDA-approved pill, Genentech's Araveg. Dr. Anthony Oro was part of the research nearly 20 years ago that provided the science behind the pill.
When you're out in the sun and you're getting exposed to the sun, you mutate this signal to the stem cells. And then you get too much of the signal in those stem cells, and that keeps growing and growing and growing, and that's what a cancer is.
The pill acts as an inhibitor to that signal known as the hedgehog pathway.
Blocks the signal that these cancer cells receive to keep growing, and they basically shrink away.
Winnie's tumors had shrunk away just 4 months after she began to take the pills daily. Dr. Oro says the majority of the group of 100, mostly in their 40s, 50s, and 60s, saw the results.
That was pretty amazing to us.
And an amazing change for Winnie, who went back to reading, writing, and most of all, watching San Francisco sports on her TV from her San Mateo nursing home, where she's looking forward to the simple pleasures in life.
Have one of the youngsters come in and say, "Good morning, time to get up, beautiful." And they're so right.
But most of all, it's things like letters from the great-grandkids that light her up.
I miss you, Gigi. I'll see you in 3 months. I love you.
And who is this young baby here?
Me.
Love that fulfills from the family who motivates her every day.
But who have also shown me the respect that an old lady treasures, and make you feel like you want to be alive.
Such a strong woman there. Now, this goes beyond just skin cancer treatment. Dr. Oro and his peers at Stanford are working on developing similar target therapy treatments for other cancers. We're talking pancreatic, colon, and prostate, and they're working on that at labs and clinics at Stanford right now. Raj.
All right, much respect. Thank you, Stephanie.